Angina is a symptom or sensation that may be an indication of underlying health problems, particularly in women. It's a sensation that is produced by a blockage in the circulation to the heart. It's most commonly arises when you exert yourself and goes away with rest. Those symptoms can be quite different in women.
My name is Debbie, and I live in Brookhaven, New York, on Long Island. My passion is ballroom dancing.
All right, places for the rumba.
It's consuming my life now. I've met the most wonderful people through dancing. Walking to get the mail, I would feel a tightness in my chest, or walking my dog, I would feel it. It was just normal daily routines.
The signs and symptoms of angina are a pressure sensation or burning in the chest. They usually come on with activities such as walking or running or dancing. They usually go away with rest. But in women, the signs and symptoms can be different.
I went to the doctor for one of my checkups, and I had mentioned to Wendy, who's the nurse practitioner, that I was having these episodes and I was afraid. I didn't know what it was, that I was getting chest pains, and I was always nervous that I was going to have another heart attack. Wendy told me that it sounded like chronic angina.
Men and women's symptoms of angina can be similar, but they can also be quite different. The typical sensation of pressure or burning with activity can occur in men and women. But in women, symptoms can be more atypical. They may not have chest pain at all. They can present with shortness of breath or fatigue. They can also present with a more sharp or localizing pain that is not associated with activity. They can also have symptoms when they're at rest or while they're sleeping. These are quite different than the symptoms men have.
When I was getting those feelings in my chest, I went from one extreme to the other. I went from being totally not worrying about it and thinking it was heartburn to thinking everything was going to be a heart attack.
Making a distinction between angina and a heart attack is very important. In angina, the symptoms are usually brief, lasting minutes to maybe a half an hour, and usually is produced by activity and goes away with rest. With a heart attack, the symptoms can be more severe and longer, lasting over a half an hour, sometimes for several hours. They usually have other symptoms like sweatiness, cool and clammy skin, and shortness of breath. In women, it's important to understand that you may not have chest pain, but have more shortness of breath, fatigue, or just feeling tired. A heart attack is a serious medical condition that needs immediate evaluation. It usually means that one of your coronary arteries have been blocked. Once your coronary artery is totally blocked, the heart muscle that it supplies begins to die, and time is of the essence. If you think you're having a heart attack, you should take a full dose aspirin, crush it and swallow it, and call 911 or get to an emergency room as soon as possible. There are many different types of angina, particularly in women. The most typical types of angina are stable angina, when you get symptoms with activity. But there are other forms of angina that are more common in women, such as variant angina. Variant angina is chest pain that occurs at rest, and it can occur at night and can be quite prolonged and very severe. Microvascular angina is a type of angina that occurs with normal arteries and no blockages, and this is also seen more common in women. Unstable angina is when stable angina has a more concerning pattern, such as occurring with less activity or at rest, and usually requires hospitalization and immediate evaluation. The most common tests for angina are laboratory work, stress testing, CAT scans, and coronary angiography. To begin with, it's important to do a good history and physical examination. Laboratories are important, such as cholesterol. The level of good and bad cholesterol are very important in deciding how to evaluate a patient with angina.
Before I confided in Wendy and my cardiologist, angina was affecting my dancing. It was holding me back because I didn't want to experience the pressure in my chest or risk another heart attack. I was really getting frustrated because my stamina wasn't getting any better, and I was just working at it and working at it and working at it, and I didn't feel like I was improving.
There are various treatments for angina. They depend on how severe your symptoms are and how high your risk for having serious underlying coronary heart disease. One of the most common treatments for angina is medical therapy. Medical therapy can be divided into treatments that reduce symptoms and treatments that reduce risk. One of the most common drugs that are used for treating angina is low-dose aspirin, nitroglycerin, calcium channel blockers, and beta blockers. You can discuss the various effects of these medications with your doctor.
Once I started the new treatment plan, I felt like I wasn't getting as many episodes of angina, and they seemed to be a lot less severe than before.
There are also medications that reduce your risk for heart attack and death. One of the most important medications are cholesterol-lowering medications called statins. Several studies have demonstrated that in conjunction with a good heart-healthy diet, that statins can reduce the rate of heart attack and even death.
I've made a lot of lifestyle changes to protect my heart. Probably the most important is my exercising. I've learned to eat much smaller meals. I think that is probably one of the biggest things that I've changed.
There are also more advanced treatments for angina that can have a significant impact on symptoms and outcomes. When on medical therapy, your symptoms are not adequately controlled, you may need a coronary angiogram. A coronary angiogram can detail where the blockages are and how severe they are, and can tailor treatments to reduce those blockages. It is very important that women advocate for themselves when they go see their doctor about angina.
With my new treatment plan, I am very confident that I can manage my angina on a long-term basis.
I feel great about my health these days. I'm still taking my anti-angina medication, but I've been able to cut down on my blood pressure medication and my cholesterol medication.
In Debbie's case, her results are far from typical. She's someone that has used a crisis in her life to act as a springboard to bring her to a different and a higher level. She is a great role model, and I talk to many of my other patients about her.
You need to do something that you enjoy doing. Dancing gave me the motivation to want to do better and maintain my angina treatment plan.
This is what success looks like. Debbie is what success looks like.